Good evening to all of you watching us tonight, both to our new viewers and to those of you who joined us 6 weeks ago for our first virtual town hall meeting. I'm Mike Buehler, McHenry County Board Chairman, and with me tonight, once again, our Public Health Administrator, Melissa Adamson, Director of Nursing, Susan Karras, and my co-host, County Board Member Lori Parrish, who serves as Chairwoman of our Public Health and Community Services Committee. Also joining us tonight is Dr. Irfan Hafiz, Infectious Disease Specialist and Chief Medical Officer for Northwestern Medicine Hospitals in Huntley, McHenry, and Woodstock. We're holding this second town hall meeting to continue answering your questions and addressing your concerns regarding the ongoing rollout of the COVID-19 vaccine in McHenry County. Much progress has been made since our first town hall on February 9th. First, a lot more people have been vaccinated. We've finished inoculating everyone in phase 1A who wanted the vaccine, and more than 2/3 of our 65 and older population prioritized in phase 1B have received one or both of the doses. Through our partnership with McHenry County Schools, many of the county's teachers and school support staff have also received the vaccine. And since our last town hall, there are a lot more paths for people to get vaccinated. At the end of February, the city of McHenry partnered with our health department to open a mass vaccination clinic for people with appointments. They did an amazing job of transforming a long vacant department store into a safe, clean, and spacious facility in less than 2 weeks. Since then, we have also entered into an agreement to open a second site at the Harvard Moose Family Center. This site will help provide all residents with equal access, especially harder hit and harder to reach populations. Also, I'm happy to announce that we're working with Willow Creek Community Church in Crystal Lake to open yet another site in the very near future. Since then, we've also been increasing and strengthening our partnerships with local hospitals and pharmacies serving as vaccine distribution points. In addition, the Illinois National Guard has been activated, and they're now assisting McHenry County with its vaccination efforts. I'll end my opening remarks with the same issue I did 6 weeks ago. The main issue holding us back is the availability of the vaccine, not the ability to administer doses. We're ready when the doses are received. I've been in regular contact with our state health officials and our representatives in the General Assembly in an ongoing effort to increase allotments to the county. Also, it's a great sign that Johnson & Johnson has been approved as a third vaccine manufacturer. It's our hope that this will increase supplies and assist in inoculation of our hard-to-reach residents who may not be able to travel to our clinics. Again, we hear your concerns and understand your frustration. And I want to assure you that it's already getting better and will continue to do so in the coming weeks. Supply will catch up with demand, which, as you can imagine, is unprecedented. Everyone who wants the vaccine will get it, and we will finally move on to a less restrictive phase of the state's Restore Illinois plan. We'll put this trying time behind us and have our businesses fully reopen, our children back in school, and our sports, festivals, and events will return to normal. Thank you for your patience. And now I'll turn this over to Member Parrish.
Thank you, Chairman Buehler. As the chairman said, I'm Lori Parrish, County Board Member from District 3 and Chair of the Public Health and Community Services Committee. Our program tonight will begin with Dr. Hafiz explaining the importance of getting your COVID-19 vaccine. He will also help us understand how the vaccine will protect us from the COVID-19 variants recently discovered in McHenry County and nearby areas. Our Director of Nursing, Susan Karras, will then give us an update on the county's vaccination efforts and the expansion of vaccine eligibility over the coming weeks. Melissa Adamson, our Public Health Administrator, will tell us about the different paths to vaccination in McHenry County and how those paths prioritize different people for vaccination. After this, we will enter into the Q&A portion of our evening. With that, Dr. Hafiz, please begin.
Good evening. Thank you very much for having me. Yeah, definitely this vaccination rollout has been a key milestone in our ability to, get control over the pandemic. A couple of things that definitely wanted to talk about. One is the importance, of course, of receiving the vaccine. And certainly what we have seen is through the trials and through some of the early data that's come back, that the effectiveness of the vaccine has been really, really good. For most other diseases, when we see effectiveness in the 50, 60% range, we do find that is very encouraging. With the Pfizer and the Moderna vaccine, we've seen data in the low to mid 90s in terms of effectiveness. And that means that it is around 94 to 95% effective in preventing death or serious disease. Yes, a few number of people can still get mild disease, but it protects the large number of the population that's been vaccinated. Another question that did come up is, how does the Pfizer and the Moderna vaccine work? And just a few points on that is, when a virus, any virus for that matter, attaches to its host, there is a protein on the surface of the virus that it uses to anchor to the host. And that protein is the key element there for it to attach. Most vaccines that are designed are either trying to mimic or trying to create a part of that protein as a means for your body's immune system to be trained so that it can fight the actual virus when it does encounter that. What we have seen in the past was there were various mechanisms to create those proteins, either by heat inactivation or chemical inactivation of the virus, because we want to just get a part of the virus, not the whole virus. But with this mRNA technology, what we're able to do now is actually get the blueprint. Rather than trying to break apart the existing virus, we actually have the blueprint of that protein. And through that, we can actually, now that protein, that mRNA molecule, that blueprint is very unstable. So we have to package it in order to deliver it to a patient. And then once it's in that host, your body's immune system can process that and create the antibodies, thereby, in essence, getting trained. It's going through a boot camp, so to speak, of how to deal with the virus. And when you do get exposed, your body, now being prepared for it, can effectively create proteins to block those receptors, those proteins on the virus, and never allow it to actually get into the cells. Or even if it does, it's in very small numbers. And that's been really a remarkable way to do that with this new technology. So it has really cut down the amount of time required to develop these vaccines that in the old process took sometimes years to do. And it's also scalable. So as different variants come around, we can actually adjust and modify the vaccine appropriately for that. And the other question that came up for me often was regarding herd immunity and what does that mean? Herd immunity is in order to have enough to stop the transmission of the virus in a community, you do need to have enough people who are immune to the virus so that the virus cannot spread easily to another person. In other words, you've interrupted its ability to transmit. And this depends on how infectious the virus is, and primarily. So there's a mathematical number for that. And with that number, when we look at the number of people that need to be vaccinated, in the case of COVID, it's around at least 70%, probably closer to 80%. So somewhere in that range. So if a population of people are somewhere in that mid 70% range vaccinated, there's enough people immune that the virus cannot spread. It interrupts the spreading of the virus, and that's called herd immunity. And that is something that we really want to aim for. We really want to be able to quickly get to herd immunity as quickly as possible there. I'm going to, the variants, just wanted to speak about. One of the concerns is that we do know that there are variants spreading through South Africa and in Brazil. And these variants have the ability to be a little more contagious and possibly even a little more deadly. And therefore, what we do want to have is enough vaccination done before these viruses, these variant viruses, are prevalent in the community. Once they are prevalent, it is possible that we may need to modify the vaccine in order to adapt to these variants. That issue is not completely resolved yet, but it is something that we would definitely have to keep in mind. So the sooner we can get vaccination to a herd immunity level and interrupt transmission, the less likely we are to see this the variant spreading. I'm going to stop there and turn it over to Susan.
Thank you, Dr. Hafiz. Greg, I'm going to have my slides up. Okay, so as of March 20th, the McHenry County Department of Health has received a total of 61,040 doses of COVID vaccine into our department. And we have kept some of these doses for us, and we've shifted some of these doses out to our community partners, including pharmacies, federally qualified healthcare facilities, hospitals, and other clinic partnerships that we have. To assist with planning at the local level, the Illinois Department of Public Health has started to provide us a 3-week allotment projections of the first and second doses and what vaccine manufacturer we are to receive. So that helps us with our planning and planning clinics further out than just the week that we are getting the vaccine. So that's been helpful for us as far as the planning of our clinics. The first dose weekly allotments, as you can see on the chart, they range from 2,300 to 5,800, very inconsistent every week. It does fluctuate. So we have a total of 11,860 doses coming within the next 3 weeks, or that is the projection that they're giving us. The second dose allotments, they are a 1-to-1 match for the number of doses that were given 3 weeks prior for Pfizer doses and 4 weeks prior for Moderna. So that's why we typically see those fluctuations in each week. So if we have a large number of first doses that we give 3 weeks from now, 4 weeks from now, those first dose allotments are going to decline a little bit, and then our second dose allotments will be elevated to match those doses that we need to give for those second doses coming in. So as you can see in what Chairman Buehler has stated in his opening remarks, the vaccine allotments continue to be limited for the demand that we have in our population. Next slide. Since our last town hall meeting on February 8th, we've given 74,822 doses have been administered to McHenry County residents, bringing us to 97,787 doses as of yesterday. That puts our total population being fully vaccinated 11.28%, and we vaccinated 67% of the 65 and older population. As vaccine supplies become more available, this is the evidence that we are accelerating our plan to get these vaccines administered. Next slide. Now this map shows our county with our points of dispensing sites, or pods, that are located throughout our county, which includes community partners, permanent pods, and our temporary pods. The community pods are those that have received or continue to receive vaccine from our county allotment. Federal and state contracted community partners are not included in this map, as they are added and updated frequently, and they can be found at the Illinois Department of Public Health's Vaccine Finder website. We've also requested and have received assistance from the Illinois National Guard to assist with accelerating our plan with the anticipation of increased numbers of vaccine allotments coming. We are receiving 1 mobile unit and 1 stationary unit. Each unit includes 6 vaccinators and 12 support staff to work at the direction of the McHenry County Department of Health's Vaccination Incident Command in implementing our local vaccination plan. The stationary unit will assist our McHenry location at 1900 North Richmond Road. The mobile unit will be deployed to clinics to reach vulnerable and high-risk populations throughout our county, as well as working in our temporary pods and our drive-through locations. As of March 22nd, the McHenry County Department of Health has opened our clinics to include all eligible priority groups in Phase 1B and Phase 1B Part 2. We will continue to prioritize those that are eligible in Phase 1A and the 65 and older population. These priority groups need to call our call center at 815-334-4045. You will be screened for your eligibility and you will be assisted with an appointment at that time. Next slide. We've also implemented a new registration system to handle the volume that we are anticipating coming in the coming weeks. So we have shifted over to a system called Amtrack. It is found at the link that you can see on the page there. So we're going to go through the process because there's been a lot of confusion since the rollout on how to make the appointment. So we'll go, through the steps of how to make your appointment as clinics are opened. So next slide. Thank you. Okay. All right, so the first page that you'll come to when you go to that link is what we call the eligibility page. This is the first page that lists all the eligibility criteria for Phase 1A and 1B that the state is in at the time. So as you scroll down, next slide, to the bottom of that page, you'll see the button that says take me to the screening question. So after reading that page, if you meet one of those criteria, you would click on that test, take to the screening questionnaire. Next slide. This is where you will answer the questionnaire as far as what priority group makes you eligible. So these are all defaulted to no, so you would need to select yes for the classification or the eligibility requirement that you fit into. You could fit into more than one, so go ahead and answer all the questions yes that you qualify for. Next slide. When you get to the bottom of that screen and answering your questions, this is where you will test that you are answering truthfully and accurately. You would hit the agree button and the next button will be, you'll be able to click on the next button. Next slide. And then there's another page that's going to confirm your answers. So it'll show the answers that you've selected. So you confirm that you answered your questions correctly. Next slide. And then this is where you will be brought to where you will search for your clinic. There's two ways to search for a clinic. You can click all events and then type in McHenry into your search events, and then all the McHenry clinics will populate underneath there. Next slide. Or you can do it by find by location. So you would click, put in your zip code, your search area as far as the number of miles, and those clinics would populate as well. Next slide. You may see a virtual waiting room because of the sheer volume that we're having that are coming in. They do not, if you let too many people in trying to, register for a clinic, it'll crash the system. So at some point you may see where you'll have you'll be put into a waiting room and it'll tell you your estimated wait time. So please be patient. Do not close your browser because if you close your browser, you're losing your place in the line. You're just going to have to start all over again. So just be patient and wait there, and you'll be launched into the registration when you come up in the queue. Next slide. This is where you then will begin your registration. So you will select from the clinics, and each clinic will have a title. And you see at the top, it has McHenry County residents, and who we are serving, and what vaccine and what doses we're giving. So when you're scheduling your appointment, you need to make sure you're selecting the correct clinic that you qualify for and the correct vaccine, especially if you're coming for a second dose. So please read carefully and be very careful about what you're selecting. Next slide. Some clinics are closed with codes. So if you do not have a code, you cannot register for certain clinics until they're open to the public. So this gives us an opportunity if we do have 65-year-olds that are still needing to register, or we are trying to play catch up from our old system with our second doses. This allows these individuals to make their appointments before we open it up to the public. So we issue them a code. So that code is very unique to that individual, and they need the code in order to make an appointment. So if you come across this on that screen, you have to select another clinic. You cannot make an appointment unless you have that code. And please do not call the health department to get the code. It's very unique. Next slide. Once you get into the clinic and you're in there, the options of the time, you select it based on if it's open. Obviously, the reds are closed. Those appointments are no longer available. So you would have to select a time that's green. Next slide. Again, it's describing who we're serving, who's allowed to, who's eligible. It has the time that you selected and what you need to bring for your appointment. On this one, you are going to pick whether you're getting your first dose or your second dose. If you're coming from for your first dose, you do not click first and second dose because you still need to make a separate appointment for your second dose. You can't do it at the same time. So you would click your first dose if it's your first, your second if it's your second. What you need to do at this point is add it to your cart once you've done that. If you have a code, there's a ticket code underneath that add to cart box that you can't see there. That's where you would put in your code if you did have a code. Next slide. Do not hit add to calendar up underneath the appointment there. That does not make your appointment. You can select that to add that to your personal calendar, like your Apple calendar or your Google or whatever Outlook, whatever calendar that you use. You could do that and have it sent to your calendar to automatically populate, but that is not making you your appointment. So there's a lot of confusion. People thought that once they hit that, they had their appointment, and that was not the case. So that is what that is for. So you add to cart. Next slide. This is where you're finalizing your appointment. You have 5 minutes to complete this registration at this point. So you want to make sure that you're getting everything in accurately and double checking. So you want to make sure you're entering a valid email address and you're entering it correctly. And then you're also under the first dose going to be verifying again. Read very carefully and check off those boxes. Next slide. At this point, you're going to review your order. It gives you your appointment time. It gives you your appointment date. It gives you what dose you're getting, the Pfizer, the type, and you're ready to go. So then next slide. Then you'll get a screen that says you're confirmed. This is where you know that you have your appointment because it says, thank you, it's confirmed. You can either download your ticket because you're going to be getting a ticket, or a ticket is going to also be emailed to you at the email that you put in the previous screen. So you can download a PDF right onto your phone or whatever, tablet, whatever you would want to bring to your appointment because you have to have that ticket for your appointment. Next slide. This is what your ticket would look like. Again, it has the type of clinic at the top with the vaccine and your appointment time. When you come to your clinic, you can either print, have it on your phone, bring it up in your email, as long as we can get to that QRC and scan that. That's what we're looking for to log you into the clinic. Next slide. And of course, we ask if you do need to cancel your appointment to please do so. And the instructions will be on your ticket, and it is in the email, confirmation email that you'll be receiving. So if you cancel your appointment, it's important for us, if you can't come, that you do that, because that opens up another slot for another resident so that they can get their vaccine. So if you know you're not going to be able to make it to your appointment, please cancel it so that somebody else can have that spot available to them. So I just want to reiterate to please be very careful, read through the instructions carefully, follow through, and then to make sure that you get your confirmation for your appointment. And as I mentioned earlier, these appointments are going to be limited, and there's a high demand. So these clinics will close up quickly, but there will be other clinics that will follow and that we will continually populate in the system. So just watch closely and be patient with getting scheduled. It'll take some time. So that will close for now, and I'm going to go ahead and pass the baton on to Melissa Adamson to explain the different pathways to get the vaccination.
Thanks, Susan. Okay, so in addition to the clinics that Susan just described that you can register through the department, there's also retail pharmacies, state mass vaccination sites, and so I'm going to walk through a couple of those. So this is how you might go about searching for retail pharmacies, and you get there by going to coronavirus.illinois.gov. Here you can see this large map. You can search by zip code or city. You can set parameters around the radius that you're searching. And what will happen is it's going to bring up a list of pharmacies. And what you do then on the right side next to the pharmacy name, it will give the address and the town that it is located in. And then you click on the link on the right-hand side. And that link takes you directly to the vaccine registration page for that particular pharmacy. We also have direct links to each of the participating pharmacies listed on our vaccine locations page on the health department's page. Next slide. So there's also state mass vaccination sites. You can access this page the same way through that coronavirus.illinois.gov. And at the top, in the narrative section at the top, you will see a blue bar that says state mass vaccination sites. These are available to all Illinois residents regardless of zip code, but they are also following the state's plan in terms of who is eligible. And as you can see, again, the site name is listed on the left. Then you've got the address, the zip code, the city, and you would click on that link to see if there are appointments available at that particular location. Next slide. So we have gotten a lot of questions about people who are interested in searching for vaccine based on the manufacturer. So this is vaccinefinder.org. And you can search by manufacturer. So right now we have all of them checked, right, on this particular slide. But if you were just searching for one in particular, you could uncheck the ones that you're not interested in. Again, put in your zip code, set the parameters for the radius that you want to search, and then up pops a series of locations that have that particular manufacturer. You will see right now, because again, vaccine is still somewhat limited, that it will show if it's in stock or out of stock. And then you would follow the directions from that point forward. Also on our vaccine locations page, we have a list of regional healthcare systems and links to their sites so that you can get information about how those hospital systems are scheduling their appointments. We also have, Susan's mentioned it, and so has the chairman. So if people need registration assistance, so if you have no or limited internet access, you may call our call center for assistance. That number is 815-334-4045. Oh, my goodness. The county's on timers, so the lights go off if you're not moving. Apologies for that. So the call center is open Monday through Friday, 8 a.m. to 4:30 p.m. The state has also recently opened a state COVID-19 call center. That number is 833-621-1284. They can also help assist individuals, residents to schedule an appointment. They are open 6 a.m. to midnight, 7 days a week. and they offer English and Spanish. So that's all I have right now, Lori.
Melissa, I have one quick question. If somebody calls the call center and does not have email capabilities, do they get a call from the call center when it's time to schedule their appointment?
They do. So we have a, we're keeping a list of those folks who have called in to our system. So when it's time for them to schedule an appointment, Susan kind of alluded to this. So we get a list of appointments that we can schedule for those folks who are calling in. And then the same thing would happen when it's time to schedule their second appointment.
Okay, and then just one other thing quickly, the people that had registered through the county website before we made this recent upgrade to the Illinois site, can we assure them that their information is still intact and are on the queue to be notified when the time comes?
Yes, and so particularly for those people who are getting second doses, right? They're getting an email through us. They've already gone through the system once. For those people who are in our database already who called in, we would reach out to them when there is an appointment. We would call them and help them schedule that appointment.
Okay, thank you.
All right, thank you. And so we'll continue with the questions. And Susan, James asks, what kind of proof will be required for those under 65 with health conditions when they go to register and seek their vaccination shot?
There's no proof that's required at the time of the clinic. So when you're registering, as I pointed out in the slide, you're attesting that you have a condition that's in that list that you'll be seeing on those pages. So when you answer yes, you're acknowledging that, yes, I have one of those pre-existing conditions, and you're attesting to that.
Okay. And Melissa, Beverly asks, I'm under 65 with chronic health conditions that put me at higher risk. Can I get my vaccine now?
So yes, Beverly would be eligible to receive her vaccine. Again, eligibility and vaccine availability are not necessarily the same things, but Beverly would have multiple ways that she can seek out vaccine, including the clinics that Susan just went through and registering online now that way, the retail pharmacies. And so those are the primary avenues. She may also have a relationship with a physician, and as the hospitals expand into other groups, there will be additional opportunities for people to get vaccinated that way. We would encourage anyone to take the first available appointment that's offered them. So if you're registered at multiple sites and a pharmacy reaches out to you and says it's time to schedule your appointment, great, take that one. We would also then encourage you to get your second dose at the same location where you received your first dose, because that is how the state allocates those allotments.
Okay, thank you. Lisa has a question for Dr. Hafiz. She asks, I had COVID and still have cognitive issues as well as a lack of smell and taste. Has the vaccine been tested on people with ongoing issues, and could it cause more issues?
Yeah, interesting question. So yes, in the trial, some people did get COVID, especially if they were exposed very early around the time of vaccination. We do want to differentiate between two things though. One is the natural course of the disease from the virus. So yes, lack of smell, cognitive issues, these have been well described. We've encountered them many, many times. The vaccine that you're receiving is not a live vaccine. It is not even a whole virus. So therefore you cannot physiologically get the disease, and therefore the pathway of complications can't occur. It is on a separate pathway. You are developing antibodies to it directly. So, and that's kind of the beauty of how these vaccines are working right now. So you really can't get the disease from it. So it should not cause any issues, but please talk to your physician first before you go ahead and get your further vaccines, just to make sure that there aren't any other nuances that are specific to you.
Thank you, Doctor. Susan, we have another question. I had my first shot at Walgreens. Do I have to go back there or can I get my second shot somewhere else?
We want you to return to where you got your first dose. So if it was at Walgreens, you should go back to Walgreens to get that dose, because as Melissa had said earlier, those allotments are sent to them. The second doses are sent where those first doses were given. So we do encourage people to go back to where they received their first vaccination. Now, there are some extraordinary situations where individuals are vaccinated out of state or in the inpatient hospital settings in different states that we've run into those situations as well. If you are in one of those extraordinary situations, we want you to call the call center at 815-334-4045 so that we can assist you to get into one of our clinics for that second dose.
Excellent, thank you. Melissa, Tim wants to know, why is McHenry County trailing behind other counties in communication, expansion of distribution behind state guidelines, and distribution of the vaccine?
Great question, Tim. So on communication, we have pushed out news releases. We've tried to share information on social media and send out other communications through our e-notifications. So there is a spot on our website where people can sign up for those things. And we've also periodically sent out some additional updates via email. With regard to the expansion and distribution of the vaccine, so counties across the state are at different points in the vaccination process. Some received vaccine weeks earlier than others. We talked about this in the first town hall, but McHenry County received its first shipment of vaccine the last week in December. Other things, depending on the size of the county and the population within the priority groups within that county, some counties have been able to move faster through the phases. Initially, our phase 1B group was projected to be greater than 70,000. And so that increased over 100,000 with the addition of the phase 1B part 2. So, just trying to give some perspective on the number of people that are in that group. McHenry County, so many county health departments have had to make difficult decisions and prioritize limited vaccine allotments to the most at risk for severe health outcomes related to COVID-19 infection. So in our county, those most at risk based on the data are the 65 and older, and we're getting them vaccinated. That has been a priority. And if anybody's read the new Restore Illinois, the bridge phase metrics require that we get 70% of our residents 65 and older their first dose of vaccine for the state. That's going to be on a statewide level in order to move forward. And so we have been making consistent progress there. And as Susan said, we have over 2/3 of our 65 plus who received that first vaccine. Mm-hmm. And then, with regard to the numbers that are on the state's website, a lot of people have gone there to look at the data. So those numbers are always changing. And I think what's important is that we have consistently increased the number of vaccines that we have administered over time. And Susan's chart clearly showed that we are really accelerating and have increased substantially since even last month's, or was it last month? What month are we in? We're almost to April, everybody. So back on February 8th, right?
Mm-hmm. All right. Yes, thanks, Melissa. Dr. Hafiz, could you please answer the following question? Do I still need to Was I muted? Dr. Hafiz, would you like me? Okay, it happens to us all, right? Dr. Hafiz, if you could answer the following question. Do I still need to wear a mask if I've been vaccinated?
Sure. So the short answer to that is yes. You still do need to continue to wear a mask in public, especially. Now, there's a few caveats to that. One is that the reasons we are vaccinating is not just to protect you, me as the individual, but to protect the community as a whole. What we do know that the vaccination does decrease the disease in individuals. What's not clear is the impact on transmission in the community. We believe it is going to have an impact, but we're still waiting for more data on that. So what the recommendation is, if you are in a public place, a restaurant, a grocery store, to continue to mask just as you always have been, regardless of the vaccination status. Right now, that is really important. About 2 weeks ago, CDC did update some guidance that if you had a small number of people, say 6 or 8 people, and they are all vaccinated, yes, they can meet without masking in that special situation there. But everyone is vaccinated and in that group there. But again, that is not applicable to the general public scenario there. So a public event, an outdoor event, a place where there's multiple families or people where you just don't know who's vaccinated or not, the default should always be wear the mask.
Thank you, Doctor. Susan, a person who wishes to remain anonymous this evening asks why and how people other than 65 plus are getting vaccines when all the 65-year-old and older individuals have not yet been vaccinated. Oh, muted.
We have vaccinated the majority of the 65 and older, and we will continue to vaccinate the 65 and older, but we're going to just go ahead and move along into these other groups and these other priority groups to keep us moving forward. So yes, there are people now that are getting vaccinated that are not 65 and older, but we're still focusing on the 65 and older who are interested. We will get you an appointment, and we're going to carry on and move on into these other priority groups.
Okay, thank you. And Melissa, Randy is wondering, when will library staff be able to receive the vaccine? Why weren't they considered educators?
So good question. So librarians associated with schools were considered part of 1B educator group. But as of March 22nd, so as of yesterday, with the governor's expansion of 1B, federal, state, and local and municipal employees are now included in the government employee definition. So that would include the librarians who are employed by a town or a city.
Okay, thank you. Susan and Dr. Hafiz, we have another individual who wants to know, will we hold special clinics for groups of seniors or other groups that want the Johnson & Johnson vaccine? Not sure who wants to start with that one.
Well, we haven't received the Johnson & Johnson vaccine yet in our county. We don't know when we will receive it. We have requested it. And when we do receive it, we are going to reserve those doses for those hard to reach populations, such as the homeless population, as well as the homebound. So that the logistics of that, the one dose would really be the best strategy to address those populations. So when we do get it, it will be reserved for those populations. And once we get through those populations, we would open it up and have that option in other clinics and our other open clinics.
The only thing I can add to that is if you are already in a group that has been prioritized and another vaccine is available, such as Pfizer or Moderna, which we are currently getting allocation for, please go ahead and take that. Don't wait for and be specific to a particular vaccine. Right now, in terms of efficacy, they're pretty close enough together. And you do have to remember that even though there's differences in the effectiveness, they aren't compared to one another. They were compared against placebo, and the groups were different. So you can't take an 85% Johnson & Johnson versus a 94% Moderna and say Moderna is better. That is not the case. So take what is first available. There really isn't a good reason to differentiate between the two. It's the first one that's available. As Susan pointed out, absolutely, Johnson & Johnson has the one advantage of being a single dose. So if you are in a group where it's difficult to get the second dose, that we want to definitely reserve it for those populations.
Thank you. Susan, Rick wrote us asking, what can you share of the plans to vaccinate homebound seniors and seniors without internet access to make those appointments?
Yeah, this has been a real challenge for us for the planning of reaching the homebound population, just with the logistics, as we mentioned earlier, of the vaccine, the 2-dose, the cold chain, the monitoring. So it is, you know, we are actively planning. We're hoping that Johnson & Johnson will be made available. That'll make our plans much easier. However, if we do not get it, we hope to implement these plans soon. We are working with many senior community-based organizations. We've reached out to home health agencies. So we're forming, you know, reaching out to these networks that we already have in place, and you know, trying to elicit a plan with them on how everybody can kind of work together to make sure that we can vaccinate that population. And as far as your question about the internet access to make appointments, again, I would encourage anyone to call the call center, the 815-334-4045 number, and they can help you to, you know, get the appointment or get on a list so that when we have appointments, we can call you. Or if you do identify yourself as a homebound senior, we're also, you know, keeping those kinds of lists so that we know who's interested and where you're at, so that when we're ready to roll out our plan, we know how to get a hold of you.
Terrific. Thank you for that answer. Melissa, Marilyn asks, I want to remain consistent with my faith. How can I be assured that I will receive either Pfizer or Moderna and not Johnson & Johnson when making an appointment?
Okay, again, so one option is to go to the Vaccine Finder website and search by manufacturer. As Susan reviewed through her slide deck in terms of what somebody will see when they go to schedule an appointment at an MCDH clinic, that information for that particular clinic will include the type of vaccine being administered. So it'll be right in the title. And if somebody wants one in particular, they can just select that particular clinic that's offering Moderna or the clinic that's offering Pfizer, for example.
All right, thank you. I have another question for Dr. Hafiz and Susan. Sandy has had her first shot and she asks, how long before my second shot is due? And will I receive a link to schedule my second appointment?
Do you want me to start, Dr. Hafiz?
Yes, go ahead and start, Susan.
So it depends on what vaccine you receive. So with Pfizer, it's a 3-week minimum so that you can get the dose. And then Moderna is a 4-week minimum for your second dose. So with our, you know, just to kind of piggyback on the Chairman Buehler's question at the beginning, if you received a vaccine before we switched to the state system, you are in our old system. You are not lost in our old system. We will be emailing you when you are due for your second dose, a link and one of those unique codes to make your second appointment for your, you know, what dose you need and what manufactured vaccine that you would need. The other, in our new system, you will be making your appointment at the time that you're at the clinic for your first shot. So when you get your first vaccine, when you're in observation, there's going to be QR codes everywhere. You'll be able to scan it and make your appointment for your next dose then when it's due. If you don't have a phone that you can scan, there will be somebody there that will help you make that appointment and print out your confirmation so that you have your code for your next appointment.
The only thing I can add is, you know, just be mindful of that second dose for that Pfizer and Moderna vaccine. You definitely you want to try to stay within that window of when the vaccine needs to be administered. You can go slightly later. You don't want to go too much sooner. So if there is travel or something else that's coming up, you do want to try to schedule both the doses so you can keep them at the right interval between them. For those patients who are starting to get their vaccine through Northwestern Medicine, similar process, you are getting an email invite to sign up. And at the time of getting that first dose, you are scheduled for your second dose as well.
Okay, thank you both. Melissa, Cindy asks, how do we have our contact information removed if we have scheduled our first and second dose vaccine appointments elsewhere?
Sure. So, as we're shifting to the new system, I think over time, we wouldn't be reaching out to people in the ways that we have, right? We could still contact people through e-notifications, but anybody who wants to have their email removed can reach out to us by sending an email to our health mailbox, and that address is health@McHenryCountyIL.gov. And just to help call it out, maybe put something like remove from vaccine list in that subject line.
All righty, I think that wraps up our questions for this evening. Chairman, I'll turn it back to you.
Sure, thank you, Ms. Parrish. Before we close, I'd just like to take this opportunity to thank our panelists for answering our questions tonight. Of course, if you have any further questions, you can call our call center as shown on the screen here. I'd also like to thank our viewers for taking the time to tune in. I hope you found this town hall useful. And for anyone that was not able to attend the town hall, the answers to the most frequently asked questions, along with a recording of tonight's program, will be placed on the county's website in the coming days. And finally, I'd like to thank the vaccinators and volunteers who have been working tirelessly to save McHenry County lives and livelihoods. We could not get through this pandemic without you. And I'd also like to acknowledge that National Public Health Week is April 5th through 11th. And we'd like to thank all of our public health workers during this time. So that being said, we will get through this pandemic together, and please stay strong, McHenry County, and good night. Thank you for joining us.